Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm delighted you could join us because our next guest, the distinguished Alain Claudel, Director of the Rehabilitation Services right here at the hospital, at CHOMP, Community Hospital, Monterey Peninsula. You're the Director of Rehab Services, Mr.
That's right.
Claudel. Thank you so much for joining us.
Well, thank you for having me.
Well, Alain Claudel, it seems to me in the past 10 years that the world of rehabilitation and physical therapy and wound care and the Balance Center, et cetera, has just mushroomed, almost exploded, and you're the director. So let's go through some of the services that are available in your department here at the hospital.
Great. Yeah, there's several departments within my departments. There's physical therapy, occupational therapy, speech therapy, and we've added, as you mentioned, hyperbaric medicine and wound care.
Well, let's mention those again. So you have, within your department, which is rehabilitation, there are certain divisions, right? So occupational therapy and physical therapy.
Correct.
And wound care.
Right.
And
speech therapy. And then
speech therapy, of course. And then you also are offering balance and vertigo services.
Correct.
Well, we're going to have to get into that. Okay, so those are all under your umbrella.
Typically, there's a discipline in medicine called physical medicine and rehabilitation that includes those specialties, and we're lucky enough to have them at Community Hospital of the Monterey Peninsula. We see patients that are in acute care, obviously, and we also see outpatients. Typically, the PM&R departments have those three disciplines. We've added, to meet the need of our community, we've added other specialties like the wound care area, which you're very familiar with, and we've also added the Balance program, which is in response to the needs of our community. Our community is aging, and we found that a lot of patients needed that extra help to rehab their ability to maintain their balance and their posture and avoid falling and being admitted in the hospital with a hip fracture or wrist fracture or the things that we see. So,
well, Alain, that's really terrific, and I think the fact that your division, your department has mushroomed has been incredible, and you're offering so many more services to so many more people in our community. So let's talk a little bit about your training and how you got to be, I assume you're a physical therapist?
I'm a physical therapist, yes.
Okay, so how does one get to be a physical therapist? Then I want to ask you how you get to be the Director of Rehab Services.
Well, that's a little bit convoluted. As you can read my name, it's not a typical name. I was born and raised in France.
Where in France?
In Lyon.
Parlez-vous français?
Je suis français.
Oh, you see that? He's so worldly. So you were born in France?
Correct.
And when did you come to the United States?
In 1988. Years and years ago. I married a wonderful lady who is actually from this area, so at one point we decided, because I could speak English, and at that time physical therapists were sought after here in the U.S. and still are, actually. It was something that came very naturally between the two of us, so we decided to move to this community.
Well, Mr. Claudel, another time, we don't have time now, but it's going to be an interesting story to find out how you and your wife met, but we'll save that for another time. So you moved here in '88. In
'88, and went through the process of obtaining a license in California. I also think that, and this is very well shared in our profession, and actually I think most professionals will share that, is you're never done. Once you have a license or a degree, you keep training and training and training, and so I kept training, and
that's why I think it's called the practice of medicine and surgery, or in practice of rehabilitation. We're never done, really.
Never done. And physicians do research. There's research conducted by other entities at universities. You have to acquire that knowledge and break it down and bring it to our patients. So I think it's never done.
Well, so summarize the training. Let's say we have a high school student who's smart and perhaps interested, and they think they may want to go into physical therapy. Summarize the training that they might go through before they became licensed to be a physical therapist.
That's an excellent question, and actually we have that. We have many high school kids in this community that are interested and would benefit from actually going through that. It's a very rewarding profession. I what we see in our patients is we see a potential. A patient comes with an open wound or a joint that doesn't work very well or weakness, and we know that with our interventions we'll get that person to a higher level. So, and most of the time we get to that. So it's a very positive profession to be in. We coach patients in their recovery. One who wants to go through that needs to have a little bit of training in chemistry, physics, a little bit of math. It's more of a scientific course. Most high school people go into either pre-med or some sort of biology or undergrad, and then they go to a physical therapy school. The entry level right now is a master's degree, but most of the schools are at a doctorate level, so it's a clinical doctorate. And the graduating schools in California, most of them are still at a doctorate level.
Okay, now I really want to get clear on that, Mr. Claudel. So if you want to be a physical therapist, of course you've got to get your high school degree, and more likely than not, you would excel in the sciences.
Correct.
And of course, you're going to want to like dealing with people. Right?
Yes.
And you're going to want to help people who need your help. So after high school, do people get a college degree?
A college degree in something that is related to the health field, or
Okay.
Or actually it doesn't really matter that much. The schools, the graduate schools are looking for people who have a little bit of background in science.
Okay, so they got to finish high school, of course, then they get a college degree, and then it's physical therapy training school after that.
Correct.
And how many years of training would people go through?
3 to 4.
3 to 4 years.
Right.
So that's after college,
Right.
3 to 4 years of training
Right.
in physical therapy. And then, as I see at the hospital, there are so-called interns, where you actually sort of do on-the-job training.
Correct.
Right?
During those 3 to 4 years, we have the students go through a didactic training in school, and they also split their time and come to a hospital or a clinic and learn with the clinicians and get to apply and demonstrate what they learn, and actually learn more about their patients than what they have had in school. So it's both.
Okay. Alain, let's say you were addressing a class full of high school seniors. Who makes a good physical therapist?
Somebody who is not afraid of being close to a person, relating to that person. Some athletic ability helps, because we do end up demonstrating movements to our patients, and it's a fairly demanding job, and a little bit of an ability in math and science and physics, chemistry.
Excellent. Okay, Alain, in the few short minutes we have left, I want to give you a few different patient scenarios,
Okay.
and I'd like you to describe how your division or your department at the hospital might help that person, okay? Let's start with a 72-year-old woman who falls one day, breaks her hip. In the emergency room, she's stabilized, and she's taken to the operating room, where her hip gets pinned and taken care of by the orthopedic surgeon, right? Now, the next day, there's an order for rehab services to get her moving. So how do you get involved to help that woman who had a hip pinning maybe late last night or yesterday? How do you help her to get mobilized again?
Well, it takes some persuasion, but it also is just a matter of helping the patient to start moving and understanding why we want her to move. If the patient stays in bed, then the complication starts coming, the deep vein thrombosis, the decompensation of the heart and lungs, and maybe even the pressure ulcer. So we really understand that, explain that to the patient, and actually paint the future to her and tell her, you know, your muscles are going to support you, you are going to go back home. Let's talk about your home environment. Let's start taking a few steps, and this afternoon we'll take 20 more steps, and then typically by the time we're done with the first session, things are on the right direction, and we do exercises and walking, and take them to our gym in the hospital, and go up and down stairs, use parallel bars, to the point that within 2 or 3 days they're ready to go home, or to go to a rehab facility where they get stronger.
Okay, now one thing I just want to clarify, you mentioned deep venous thrombosis. That's a condition that people who lay in bed for long periods of time can get, where the venous stasis, or the blood in the veins gets sort of quiet, and they can develop a clot, which can actually sort of travel to the lung, which is a problem. That's a pulmonary embolus. So you want to get these people moving, correct?
Absolutely.
So it sounds like a lot of your work is preventative in terms of you want to prevent complications from ensuing following an operation or, say, following an injury such as a hip fracture.
Correct.
So what about the patient scenario where a young woman is a semi-pro softball player, she gets a shoulder injury, she has shoulder arthroscopy, she's sent home, but then she's sent to your clinic for outpatient rehab services. So what does that semi-pro softball player get in terms of preventative, or how do you help her get back to her regular life and to sports?
Right after surgery, the first thing is to get rid of the pain and the inflammation. The inflammation process is necessary to help in the healing process, but when it's overwhelming, there's pain associated with that. So we'd like to quiet the joint and decrease the inflammatory process. And then the recovery starts, strengthening the muscles. As soon as the muscles are healing and glued together, then we can start within the protocol strengthening those muscles. Even if it's not a professional or semi-professional athletes, all of us would benefit from specific exercises to prevent the degeneration of the joint. Muscle is a crucial tissue, as you know, to stabilize joints and to help people continue movement, which is so crucial to our health. So with this person, we would obviously give her a set of exercises and progress those exercises to a very high level. But most of us would benefit from a regular exercise program. If you come with pain in your shoulder, whether you had surgery or not, we would still work on the same muscles, albeit at a different level, obviously, than a semi-pro.
Mr. Claudel, most of my audience knows that I'm a plastic surgeon, and I'm lucky enough I get to do a lot of hand surgery, and I work with your department quite a bit. I'm very pleased, of course, with the expertise there. It's always difficult for patients after a hand operation, and I think for any orthopedic operation, there's some people who are very reluctant to move, and then on the other end of the spectrum, there's people who want to go out and lift weights and do everything they can the very next day. But really the smart thing to do, especially in occupational therapy, is very controlled, very coached, very systematic and scientific method for road to recovery. Isn't that correct?
That's absolutely correct. We know from investigating how wounds heal, whether they're surgical wounds or regular wounds, we know that there's a certain timing that takes place. Things don't happen, things happen in a very sequential and determined way. So when you repair somebody's tendon, for example, we have to make sure that the tendon will be able to take the strain that we want to apply on the tendon in order to gain the range of motion. And it's a very delicate balance. And all this comes from years of studying and experience and so on. And also, we like to partner with you because you were there when the tendon was repaired and you actually visualized the tendon. We don't get to do that. But you can tell us this is looking good, or this we want to slow down a little bit. So there's the science, and then there's also the collaboration between the surgeon and the therapist. And you know, we mentioned the hand therapist and continuing education. Amy has a specialty in hand therapy, and as you know, Amy and others in the community also have acquired a degree of comfort and knowledge, and those are the people that I listen to.
Well, we're lucky. We're really lucky and blessed to have experts in hand therapy and physical therapy in this community. Now, you did mention wound healing. It may be surprising to some people that rehabilitation specialists can get involved with wound healing. I'm a plastic surgeon, as I said, most of the audience knows, and I'm lucky that when I have a problem wound, I can send the patient to see you, or I can send the patient to see Dr. Johnson for hyperbaric oxygen, etc. So how do you get involved with problem wounds, and why is it that some wounds seem to heal by themselves or with simple wound care, and other times they need specialized physical therapy or hyperbaric oxygen?
That's, wow, how much time do we have? Historically, physical therapists have been involved in wound care because they used to have tanks with water to treat kids with polio. And then when the vaccine came, we still had the tanks and we didn't have any patients, so we started treating wounds. Now we moved away from the tanks, but we still apply physical agents and we still apply our knowledge to help the wounds heal. Some wounds heal very well. Some wounds have a hard time healing, and that depends on the comorbidities of the patient. And one of the things that helps wounds heal is oxygen. We know that when the tissues are flooded with oxygen, then all the processes, the natural healing processes take place faster. Community hospital has decided to acquire some hyperbaric oxygen chambers so that those patients who have a really hard time healing the wounds would benefit from this and avoid more surgery and sometimes surgeries that are not very favorable. You said that you send your patients to us. We're actually lucky to have you. When we have those patients with wounds, and we don't heal every wound. And just a couple of weeks ago, we picked up the phone and said, "Hey, Dr. Morwood, can you come and see this patient?" So it's really a collaborative work. That we have tools to help a wound heal, whether it be hyperbaric oxygen or dressings or changes in lifestyle and so on. But it's a collaborative effort between all the providers in this community. And we are pretty lucky with that.
And it works best for the patients.
Right.
Now, Mr. Claudel, I only have about a minute, so I want to ask two more things. If people have questions or they want to find out more about the Wound Care Center or physical therapy, etc., can they call a number or see a website? And just very briefly, tell us about your work with people who have trouble with balance.
Sure. And all this is available on the chomp.org website.
Okay, so CHOMP.org, and they go to the Department of Rehabilitation, or is there something they can click on there?
Yes, there's a button that says what we do, and under that there's rehabilitation services, and our programs are listed.
Okay, perfect. Now, very briefly, I understand you people are taking care of patients with vertigo, or
right.
So just summarize that.
So vertigo is a problem in the inner ear. Our inner ear is a gyroscope that keeps us upright and coordinates our head movement with our eyes and our sense of being upright. If that doesn't work, it's terrible. People are very sick, throw up, and can't maintain their posture. And there's very simple interventions that we can help and unclog the I don't want to go into too much detail, the semicircular canals that are in the inner ear. That's one part of it. Also, there's patients who fall because of their nerves not working very well, their muscles not working very well, and we have therapists who are able to differentiate what system in the body doesn't work and why people fall, and are able to rehab the patient.
Well, Alain Claudel, that's a perfect segue for me to invite you to come on the program again.
Absolutely.
And I hope you would. It's been great. Let me give the audience once again. Your name is Alain Claudel. You're the Director of Rehabilitation Services right here at Community Hospital in Monterey. And they can find out more information by going to chomp.org, CHOMP.org, and go to rehabilitation. Alain, thanks so much for joining us. It's been great. And I do hope you come on again. Please come on the program. Thanks for being here.
It's my pleasure.
I am Dr. David Morwood, and this is Your Health Radio and Television program. We're going to take a very brief pause for a good cause. We'll be right back.